Right, so I'll just start over, just mentioning layout of what Delta Omega is and about our career panel and how you get involved with our career panel today. What questions, whatever you have, you can ask, and then what work they have done in past year due to COVID, how their work has changed due to the pandemic, and anything that you wanted to ask regarding your career. So first to start off with, like as you all know, that Delta Omega is the honorary society for like studies in public health, and that was founded in 1924, and we have over 20,000 members throughout the United States and Puerto Rico. And the main mission of this society is to promote the excellence in contributing to the field of public health and also advancing the health of people in every aspect. So, like the membership and election that is based on the outstanding performance for students in academia and teaching and research for faculty members and community service of the alumni. And we are proud to be the part of Delta Kappa chapter of the Delta Omega Honor Society at Hofstra University. And this really helps us to get involved with the leadership and get connected with our community and what type of work they have been doing and how they're involved with. So we have some great leaders from our public health field, and not to mention like how much work, how much their work has affected due to the pandemic, and how they have molded themselves and shaped themselves into this new transition of work from their day-to-day regular duties or activities. So now I just want to pass over to Maggie, and she'll take care of from here. Thank you.
Thank you so much, Utsavi, and thank you everyone for coming. Welcome. As Utsavi said, this is the Delta Omega Career Panel. We've been doing this now for a few years. Last year was our first adventure into this whole virtual career panel, and so we decided to do it again. This year, we're hoping that this will end up being much more of a discussion. So if you have questions at any time, please feel free to put them in the chat. We will be keeping an eye on that. So again, thank you all for coming. My name is Maggie. I'm the president of the Delta Omega Honor Society, the Hofstra's chapter, and I work for a pediatric-led nonprofit, and I'm also an adjunct professor at Hofstra. So that's kind of how I'm then, through my work and my experience as an alumni of Hofstra's MPH program, I got involved in Delta Omega. So we're here with an incredibly diverse and exciting group of panelists, most of whom are actual members of Delta Omega themselves, whether they're students, alumni, or partners. We also have leaders from their own respective organizations here as well. And everyone on the panel has extensive experience either in research, community-based organization work, the medical field, and government agencies as well. So it should be a very exciting and lively discussion. So without further ado, I'm going to go ahead and get us started. So I'm going to turn it over to the panelists and ask you guys to sort of tell your story in about 2-3 minutes of how you ended up in your current job. So I think Dr. Moskowitz mentioned he came into public health by accident. So anything kind of in that vein. So actually, I'm going to turn it over now. Dr. Moskowitz, why don't you kick us off, and then I'm going to go in order from there based on who's on my screen.
Yeah, thank you so much for that introduction. Like, I think most great things in life, you do find it by accident here. Mostly because you're interested. You're interested in something, you don't know what it is, you kind of wander in and bada boom, there you are. Mine started with my EMS days back in the day in college. I was the chief of my local volunteer squad, and I was really into it. I was going to medical school. I said, I want to get more involved with EMS. Then my mentor at the time, she said, you got to get your MPH. It's the way you get in. And there I found myself in public health school and realized, wow, there's so much more I can do with this than just what I thought initially. And it really opened my eyes. And no longer did I want to just do medical direction for an EMS agency. I was now very much interested in population health and, population well-being, and how do you heal off a million people at a time rather than one patient at a time. That's kind of how I found myself pouring in and eventually getting a Hofstra. I was doing another degree and getting invited to come lecture for the MPH school. Next thing you know, I'm being invited back again and again. And here I am now 6, 8 years later. I lose track of time.
All right, awesome. Thank you so much. And now I'm just going to go in order of who's on my screen. So Dr. Eisenstein, you are up next.
All right. Thank you very much. Good evening, everybody. So I certainly didn't wake up. I'm the Commissioner of Health in Nassau County. I have been since 2011. So I'm coming on 10 years as Commissioner. I was Deputy Commissioner for a couple of years before that. And I was actually hired in 2009 out of private practice as an infectious disease specialist, which is what I'm trained in. I was hired to manage the county's response to the massive H1N1 pandemic of 2009. And in retrospect, nobody even remembers that, but it was kind of a big deal back then. H1N1 type of influenza certainly impacted the population slightly differently, had its own features. But I certainly, when I was a practicing doctor and training at what was then Winthrop Hospital, I didn't even know there was a commissioner of health. It wasn't something that I aspired to, but I was chief resident in the Department of Internal Medicine, so I knew I had a knack for administration. And when I finished my training and fellowship in infectious disease at Winthrop, I wanted to stay at Winthrop, but there was no funding for another position. So I got a grant, and I brought grant money to the hospital to do an HIV testing initiative and run an STD office, which as a new infectious disease doctor was one of the few open, I would say, niches for a new doctor in infectious disease. And through that, I got to meet the Commissioner of Health, who at the time, Dr. Carney, who's now employed by the Northwell system, the head of the geriatrics and palliative care. I met her and called her up and said, I want to be, I'm the new HIV doctor. Please send me patients. I want to introduce myself to you. And about a year later, she called me. And this is a story I love to tell because I think there's so much of whether you succeed in life and where you end up is if opportunities pop up when you least expect it. And people who are ready to jump on them, it can alter your life. And I'm sitting home one day with my wife watching TV and the phone rings, and it was Dr. Carney, the Commissioner of Health, who I had spoken to once in my whole life. And she said, I need a favor. And I said, oh, and my wife said, say yes. I said, what do you mean? I haven't heard the favor yet. And she said, doesn't matter. The Commissioner of Health called you and asked for a favor. You say yes to whatever it is. And she needed a young HIV doctor or any HIV doctor to sit on the Ryan White Planning Council for Long Island, which brings at the time between $8 and $10 million a year in for HIV services on Long Island for our residents with HIV and no other means of affording to cover their care. She asked me to be the doctor to sit on that. It was voluntary. It was a lot of work. You don't get paid. And she said, it's not a lot of fun. She said, but you'll get to sit and meet me and we'll meet at the meeting. So I went to the meetings. I said yes, of course. And I got to sit with her and we got to know each other. And a year later, she called me up and said, now we're friendly. She said, I have another favor. I need you to do a presentation. Every few years, they need a doctor to give an update to the Ryan White Planning Council. And so I did a PowerPoint presentation and I love to teach. And when it was over, she said, you have such a knack for the administrative side and you love to teach. And we've got a pandemic. I wish I could convince you to be my deputy commissioner and come run the H1N1 pandemic. And what she didn't know is I was coming to an end of my contract and I was considering my options, and that was exactly the right time and place. So I said, where do I sign? And she said, no, I'm serious. I said, me too. And the next thing I knew, a few weeks later, I was the deputy commissioner at the health department. And that's just because I said yes to doing a favor out of the blue, and that at that exact moment, you don't respond right or you're unprepared, maybe life takes a different course for me. And a few years later, she got a different opportunity, which was good for her. And by then, the administration had gotten to know me and offered me to be the commissioner. That was 2011. A decade later, here we are. And so I've seen a lot and learned a lot. And one of the fun things for me is still teaching at Hofstra every semester. And I believe we have 7 full-time employees who are graduates of Hofstra's MPH program, whether they took classes with me or they were referred to me by one of the other professors or whatever it is. So we consider the Nassau County Department of Health, Hofstra is the home team. The public health program is our home team. And so I love teaching there. And we have a lot of students rotate through our department. Hope to see many of you. And I'll stop there.
Thank you so much, Dr. Eisenstein. Yeah, I know that you spoke at our alumni event earlier this year as well, and we so appreciate the partnership that you have with Hofstra, both the alumni and current students. So thanks. Next up, I see Arpita is on my screen.
Hello, everyone. So for me, the journey has been a little different than most people. I was working as a physician in India until a few years back. That's when I moved to the United States. And I was looking for opportunities, trying to figure out where I want my career to go. And in that duration, I did participate in a lot of research projects in different hospital systems here. And then when I was assisting with the research, I realized, I need to learn a little more about statistics. I need to be able to do my SAS analysis on my own. So I decided that I have to learn this. So going a little forward, then I had an opportunity to write a grant, and my first grant wasn't accepted. So I'm like, okay, now this is time for me to go back to school, get the skills I need for my career going forward. And public health was the best program for me. While I was working as a physician, community health and preventive medicine was my passion. So moving forward to, the skills that I was lacking, or I thought I needed to study more about, I think public health program was the best for me. So I went ahead and completed my master's in public health from Hofstra in 2018. And today I have a very fulfilling career, thanks to the program and thanks to all the mentors I had in the program. And that's it from me.
Awesome. Thank you so much. Next, I see Marissa is on my screen.
Hi, good evening, everyone. My name is Marissa Hiruma. I am the product manager at a nonprofit organization here on Long Island called the Health and Welfare Council of Long Island. We are an umbrella organization that convenes the nonprofit sector in a variety of areas. In terms of my background, it's been a little bit varied. I was pre-med in undergrad, and then after some abysmal performances on physics exams, that quickly went out the window. But from there, during my undergrad times, I was at school in the city, and started tutoring at schools, and remember times when I was trying to teach 10th graders how to subtract, and really recognizing a really tremendous need within our own communities, when at the time I was really thinking of looking at international health and international economics. So I graduated from college in 2008, which for those of you who remember was not exactly the best time to graduate and try and find a job. So I found myself working in residency education programs at the NYU School of Medicine. And from there, through a variety of different opportunities, became really interested in the concept of determinants of health. And from there, ended up, while I was still working at NYU, pursued a master's in social policy with like a focus in education policy as well. And I think it really sort of stemmed from seeing a need and a desire to improve the human condition and people around us and in our communities. So I dabbled a little bit in residency education. Superstorm Sandy hit, as Dr. Eisenstein mentioned, and I was down in the Rockaways volunteering, and again, just seeing how people were suffering, not just from the physical impacts of the storm, but all the ancillary things that happen. So that the mental health trauma, the not having safe housing, not having access to food, that actually encouraged me to leave my job. I came to the Health and Welfare Council at a previous position responding to Superstorm Sandy, where we coordinated the nonprofit sector's response at that time, which again, it wasn't strictly just structural damage that we were looking at. It was a really wide variety of needs that people were seeing. That was a different role at Health and Welfare Council. I left temporarily and came back, and have been recently working on a variety of projects. That's the beauty, I think, of working at a small community-based organization. But as I mentioned, we are an umbrella organization that convenes a lot of the entire nonprofit sector on Long Island. And two of our largest coalitions are our Disaster Response Coalition, which has been responding to the COVID-19 pandemic since the beginning since March 2020. And then we also have a Health Equity Alliance, which has been around for several years, really looking at health disparities and all of the social determinants of health. And so much of that work has been so intertwined over the past year. And so excited to tell you more about that.
Awesome. Thank you so much. I think that the community-based organizations, because I also work for a community-based organization that partners with the Health and Welfare Council of Long Island. So the boots on the ground experience from the community-based organization side of things is, especially during the pandemic, has been remarkable. So thank you. Next, Carrie, you can go ahead.
All right. Yeah. Hi. I'm Carrie. I graduated from the Hofstra MPH program in 2018 with Maggie and with Arpita. And now I am at Northwell Health. I'm a clinical research coordinator there. I guess going back to how I got into public health, I think my story is kind of similar to others in that it was kind of by chance that I got into public health. In, I guess, high school and college, I knew that I was interested in biology and health and that kind of vibe, but I also kind of knew that I didn't want to be clinical, as in like going to medical school or nursing school or something like that. So I majored in psychology in undergrad, just kind of as a like catch-all major, because I just kind of heard that you could kind of get into anything with a psych major. And then in college, I took a bunch of classes that kind of touched on public health a little bit, like some sociology classes that dealt with health and healthcare, and just some psych classes that dealt with health as well. And then when I got out of college, I got really into fitness and health, and I knew that what I really liked was preventative rather than rather than clinical and like medicine and treating already sick people. That's just kind of where I knew I wanted to be. So I ended up looking into like a bunch of different types of graduate programs, and I actually landed on the industrial organizational psychology program at Hofstra, because that interested me as well. But when I started talking to the professors in that program, one of the professors in that program actually also taught in the public health program, and she kind of convinced me, like, I think you're supposed to be over here, not over here. And I was like, wait, yes. And it literally was like, okay, you have to send us a quick letter of intent tomorrow by 10 a.m. and then we can get you in like tomorrow. So it just all happened, like, and it was very like, I don't know what the word is. It was just like perfectly lined up that it just happened. And honestly, I never regretted a single like moment, because I loved the Hofstra MPH program. I loved learning about public health, and I love the Hofstra MPH program, especially because also it's kind of like a general program, and you can explore like a bunch of different things that you can do with public health in that program. You don't have to stick with one kind of major or concentration or anything like that. And then when I finished the program, I guess kind of just through my contacts in school and through the alumni, I landed at Northwell in a research position. And it was at the Cancer Institute, which I loved because I learned like so much of like the basics of research. And then again, through my network, I switched to another position at Northwell that was in endocrinology, which I really liked because I'm interested in diabetes as well. And now I actually am working in COVID research. And again, that just happened because it happened. And I kind of started working in the position that I am now, just like helping out because I just wanted to help out with COVID in some way. I wanted to feel like useful in the pandemic. And then I was actually just kind of offered it as a full-time position to step away from my other position in the department. And this is all under the Department of Medicine in Northwell. And yeah, that's where I am now. And we actually just, the research that we were working on in the summer just actually came out and was published. So it looks like, I guess it's nice to see that your work actually does, I don't know, your efforts come to something in the end. So I guess that's my little story. So
Awesome. Thanks so much, Carrie. Yeah, I remember when you joined us on like the second week of class, ending up in our cohort. The generalist program at Hofstra was a big draw for I know me as well, and a number of people in our cohort. So it definitely applies to a lot of different paths, because I think we all kind of went on our own path a little bit after that program. So thank you. And in case anybody didn't see, people have been putting emojis up to show their love for all of you guys talking. So I have been seeing that. I forgot to mention it before, but so keep an eye on that. And then last but certainly not least, we have Aditya.
Thank you, Maggie. Hello, everyone. My name is Aditya Bisunath. I am currently a clinical research supervisor in the Department of Pediatrics at Northwell Health. I oversee research in 4 pediatric divisions. We have over 40 research studies of many different kinds. I am a graduate of Hofstra's MPH program and MBA program, and I'm also an adjunct faculty member in the MPH program. I guess thinking back of when public health really showed itself to me, I would say in undergrad. I completed a bachelor's in toxicology, and my last semester, we were required to do a large group risk assessment capstone. And we were given this scenario with a small town, an exposure from an unknown chemical, and we had to walk through the entire risk assessment process. So, little did I know that I was really being involved in public health without even using the terminology. And right afterwards, I started studying for law school. At that point, I thought I was going to go to law school. And then, having conversations with some of my professors, the term public health started showing up. And then so I decided to look at public health programs. What was public health? Where is it going? And at that time, public health was anticipated, the job market was going to boom. And, this where we are right now is a perfect example. And so I got accepted to the MPH program at Hofstra. And it's been one of the greatest things that I think I've accomplished. And from there, I've just continued to make connections, and that's how I ended up landing at Northwell. And I've been there for about 5 years, and now I'm in my current position.
Awesome. So thank you so much, Aditya. Yeah, so we have a very diverse group of panelists here, and I am seeing a little bit more love going around on the the little emoji things that pop up in the corner. So thanks, guys. And just a reminder, you can also put some questions in the chat if you have anything, and we'll make sure to get to them either in between questions, and then we'll have time for more of an open forum at the end. So you just all heard from each of our panelists. Again, very mixed background, which is great because the field of public health is so diverse. And there's a lot of different paths that you can take. Right now, I know that at least for me, because anyone in like my family or some of my friends, they knew I was in public health. So as soon as the pandemic hit, I got messages from people asking me what I knew. And I do more community-based research, and I don't really do epidemiology. So, but I was able to answer because public health kind of does that. So with public health kind of being pulled into the forefront and getting a lot more recognition, and as a result of the COVID-19 pandemic, there have been a lot of questions about what is public health. So maybe, so now I'm going to turn it over to the panelists and see, in your own words, how would you kind of define public health?
Sorry, Maggie, are we going in order, or do we just jump in?
Just jump in, go right ahead. Yeah.
I guess I'll get it started. So, public health in its own, it is, I guess you could say, a science, right? And it's, the practice of promoting health, healthy behaviors, and disease prevention. And, public health, operates on a larger scale. So it's a larger approach looking to protect the communities and the population as a whole, as opposed to the individual approach of changing health, lifestyles, and behaviors of one particular person. And, this pandemic being a great example of how public health typically works on the back end, right? Ensuring that we're taking the right steps to keep our communities healthy. And then when things like a pandemic come out, that's when, people, I guess the blinds get pulled and and you see public health on the back, doing all the work that it's been doing for years, trying to keep everyone healthy and sane. So I guess that's my definition.
Thanks. And then Dr. Moskowitz, I saw you take yourself off mute. Yeah.
Yeah, public health is like that hidden part that no one ever wants to talk to or pay attention to because it's never very exciting. But the reality is what we all need to survive and live and thrive, right? People in medicine would much rather spend money on a gastric bypass and talk about weight reduction, education, diabetes care, because that's just the way society is built all these years. I think this virus definitely helped open the eyes to the value of public health, and we'll see how long people remember that. But it's super important. What I didn't mention during my introduction was my background is an emergency physician, and why I find it super exciting to intubate a patient and save one life. I find it more exciting to find ways to prevent an intubation and save 1,000 lives at a time, and that's really where my drive comes from. I find that through proper planning and pre-programming, I think you can really make big differences and prevent bad outcomes. When Larry used to lecture on my course, I remember one of the things he talked about with the evacuation of Sandy was about how you had a process. So when the event came, he said, no, we're following the process. We're not deviating. And I repeat that a lot on my daily basis, even in the ED today. This is our process. These are expectations. These are escalation factors. And when COVID hit, it was no different for us in the ED because this is the measures we put in place, and these are our triggers, and this is what we're going to escalate, and this is what we're going to do. Don't think about it. This is why these safety measures are here. And, it's something as simple as creating a checklist for safety, as is very popular right now, but it makes huge difference with huge outcomes and huge rewards. It's just unfortunately not always tangible because there's always the hidden rewards and the hidden payments that you get as a result out of it.
Yeah, and I'll jump in, and I'm going to agree with both of Aditya and Dr. Moskowitz. And one thing that you heard, the definitions come out of a textbook. We all have kind of our idea of what it is. But I think that an important point that Aditya mentioned was that public health is kind of on the back end. And tying that to what Dr. Moskowitz said, we really should be seen as on the front end, because if we get to the back end, it's too late. Our chance to prevent, and really what we are is preventive medicine. It's the science of preventive medicine, not necessarily doctors and nurses medicine, but medicine is talking about the health of our residents, and it's beyond physical health. It includes mental health and social wellness, and that ties into the determinants which we heard about before. But we can come to an agreement on this meeting of what the definition of public health is. But one of our great challenges is we may all think we know what it is and have our own definition, but the overwhelming majority of the public does not know, when we're not in the middle of COVID, what your health departments are doing. Every single jurisdiction in America is required by federal law to have a public health department. In some cases, it's all run by the state. In some cases, like New York, each county has their own health department. In some states like Connecticut, there are over 300 health departments because every little village and town has their own. So there isn't even a standardization of how we practice. But anywhere you go in the United States, if you see a police officer, the color of the shirt may be lighter blue or darker blue or a different color altogether, but everybody knows what they do, what services they provide, how they can help you. And anywhere you go in the United States, you might see a firefighter, and the fire truck may be red, or it might be white, or it might be yellow, but everybody knows what that firefighter does and how they can serve you and how they can help you. So every single jurisdiction in the United States has a public health department. And if you ask the average person, they don't have a clue. Some might say, oh, they inspect restaurants. And in some cases, that is a responsibility of the health department, not in all cases. And some say, oh, they give shots or they provide an STD clinic. But in general, the majority of the public knows fully well what police and fire and other life-saving first responders do, and they have no idea what public health does. And the work that we've done, public health, by we, I'm talking about the public health community as a whole, during this pandemic has absolutely saved lives. And I have great respect for the police and fire and the Army and all the people that run in to save lives, that put themselves in direct danger. But we shouldn't lose sight of the fact that microorganisms, whether it's coronavirus or the influenza virus or strep bacteria or a drug-resistant fungus that's starting to pop up in hospitals, or tuberculosis, or malaria transmitted by mosquitoes. Microorganisms kill way, way, way more people than any other cause of death in the world. And so public health is life-saving. When you give vaccines, you are saving lives. When you discover antibiotics, you are saving lives. When you make sure the food supply and the water supply is safe, the two things that you could do in a society to dramatically increase lifespan is clean water, and that's why the Peace Corps over the years is always putting in wells in the developing areas that they go visit, and vaccinations. Both of those are at the core of public health. Those are the things that you can do to increase the lifespan of the public. Two core public health initiatives. And the ironic thing about it is, in the last decade, there have been a net loss of 60,000 governmental public health jobs. Now, for all of you MPH students, don't panic. Every time I say that statistic, the room full of students just gets this scared look like there's not going to be a job. More than that has been gained in the private sector. So there is a need for public health. But the point that I'm trying to make is 60,000 governmental public health jobs less in the United States at 2020 than there was in 2010, because it's always easy to cut public health when we're not in times of pandemic. It's hard to quantify what public health is doing, yet there's no other life-saving initiative, police work, fire, military. There's nowhere else that our American society would tolerate that kind of loss of workforce in something that's so life-saving, only in public health. And so what I hope comes of this is a permanent knowledge that your public health departments are here forever and train. And the response has been great because we are prepared. And those plans that Dr. Moskowitz talked about, we have a pandemic plan. We have a plan for this. We've followed the plan for this. This is not a surprise. What is a surprise is just how awful the impact has been on society that we were shut down for a year. But if you look at the flu of 1918, it really was, if anything, not different, maybe longer and maybe worse in a certain sense. History shows us pandemics will happen. Public health is prepared. We do the best we can to prepare, and we're going to keep following the plan. When this is over, that's when you look at the plans and say, how could we didn't anticipate for this and that and the other, and you incorporate them and you train. But, as of today, I think this is an absolutely remarkable number, okay? As of today, between the health department and our hospital partners led by Northwell, but all the hospital partners and all private agencies that have assisted, 560,000 Nassau County residents have already received at least one dose of a vaccine. A year ago, we were in a brand new pandemic that was killing a horrific number of people. In less than a year, thanks to public health efforts, almost more than half of the adult population of this county is now protected from dying. And these vaccines, this is a wild statistic. There's still that I've seen, if you've seen one, Dr. Moskowitz, please share with me, but I still have not seen a case report of not one person in the United States of America who's fully vaccinated who has died of COVID. Think about that. This is a virus that has killed more than 500,000 Americans, and there's not one person in the case reports that I've seen who died of COVID after being fully vaccinated. Yes, after one dose. Yes, shortly after, but fully vaccinated, meaning 2 weeks after your final dose. And the year was a very long year. In another sense, it was a very fast year. It's kind of the most bizarre passage of time ever. But it is in a large part because of the public health infrastructure. Not only health departments, the public health research laboratories, the laboratories that study the genetic sequencing of viruses. Those people never get any light shined on them, but they're the ones that are the reason that so many people now are going to live. Public health goes to many levels. The response is truly dramatic and amazing. We have tragic death numbers and we won't be able to get past them. But I can't imagine what those numbers would be without public health from every aspect of it, whether it be in the laboratory, whether it be in the field, whether it be the teams that are out vaccinating in hospitals, whether it be just the awareness that public health educators are doing to convince people to get vaccinated. To the legislators who fund us. I mean, there's so many aspects of this, but the response to this, despite this being the worst tragedy, hopefully for our entire lifespan that we'll witness as a whole and in the world, the response has been remarkable. And that's because public health is smart and strong and prepared. I'll stop there.
I feel like you tagged me in there, so I feel like I have to jump back in. I apologize, but you know, it's the perceptions of people. They haven't realized how important their lives are worth. If you take your car to the mechanic to get an oil change every 3,000 miles, I don't know, I live in the city, I don't have a car anymore, but you go to the oil mechanic, and if that car breaks down, do you say, how dare you? One car broke down, you're going to lose your license and your job and fire you? No. So one person gets COVID after a vaccine, and the whole vaccination process is terrible. But you're right, no one died or got hospitalized, which is the actual metric. And people fail to see the big picture sometimes because they want perfection. And this is where things get a lot of control. And I think we've been a very poor educator as a society, talking about what these true values are. And like I said, some of them are hidden values you can't see and people just can't accept because of that. But until we find a way to craft the message and get people to value it differently, what is your value of going to the ER and telling you you don't have a heart attack? Well, doc, you didn't do any tests. How do you know that? Well, I know that based on my training. I can go ahead and spend $10,000 if you want. I'll keep you in the hospital for 3 days. I'll spin you in circles and tell you that you're fine. Or I can just send you home now. But people don't see that. And they get a bill like, I'm not paying for this, while they're pulling out their fancy shopping bag with their credit cards, complaining about the $10 copay. And it's the priorities that people have that are very different. And until we find a way to message better and expect people to understand better, one of the talks that I give in my class, which my students have already heard this semester, so I can say it now, is what is the value of emergency care in this country as an example, right? If you listen to politicians, we have to decrease the cost of that expensive emergency care. Well, emergency care is 2% of the healthcare dollar. 2%, 2 cents a healthcare dollar. And if you look at the healthcare we deliver, only 2% of it is wasteful. So really it's 2% of the 2% of the healthcare budget. So we're talking about budget dust. And so when they're trying to cut things, it's these wrong perceptions. And that's what we need to try to focus. And the things that people don't want to focus on end of life care, you know, planning for the future, when fertility care is out there, vaccinations and preventing disease. They would rather, unfortunately, shell it out, I think, on things that are directly obvious, like surgery. And then that's where, you know, it's public health needs to come back and fight harder. Sorry for my rant.
No, please rant away. Any of the other panelists want to chime in on public health and kind of what it is and how we perceive it? Arpita, yay, saw you take yourself off mute.
Okay, so yeah, I think everyone's covered really good points. I believe public health is, you know, every one of us, like, I'm not talking specifically for COVID here. All of us public health professionals have some things we are passionate about regarding some specific health issues. Somebody is passionate about mental health. Somebody else is passionate about certain outcome. It's just about researching what is available, the resources which are already available in the community, and coming up with creative tools to actually achieve those outcomes that we desire. A lot of times in the process, the first step might be researching what's available. Maybe you can apply for grants. Maybe you have to make a list of what you need. So it entails a lot of in-depth research. Then you find out what are the tools that you can create to actually get to your outcomes. And eventually at certain time point, you will be able to create a framework which is self-sustaining. So eventually, you know, your community health, the health of the community you're living in is going to improve because that self-sustaining framework which you worked on is now functioning, and maybe a lot of people will benefit from it. You might never know them personally, or they might not know what you did, but I think it's very fulfilling in the end that you're able to improve the outcomes for a big chunk of people and without ever actually meeting them in person. And that's it from me.
Absolutely. So public health is a lot of different things. And we heard from a few of our panelists about just a completely wide and very diverse range of all the ways that public health, both through the pandemic and then in navigating healthcare systems and stuff like that, has all falls under that sort of umbrella of public health. So my next question for the panelists is the role of sort of policy and advocacy, because we've talked about issues with funding. Some of you have experience with community-based organizations, public hospitals, our Nassau County Department of Health. So kind of what role does policy and advocacy play in the field of public health?
I'll jump in from the community-based organization perspective. I mean, obviously, the easy answer to that is it's a tremendous role. And I think what we've seen over the course of the past year, especially as we look at federal legislation coming down, the need for a wide variety of advocacy in a variety of realms. And you're going to be really sick of me by the end of this hour saying social determinants of health, but we know that that housing, that access to healthy food, that all these things that are not necessarily, served in a hospital setting or in a clinical setting are so indicative of how health outcomes are of health outcomes. I think there's been a lot of advocacy about, the stimulus, the dollars coming down, recognizing that, we have a lot of individuals who, there's been an eviction moratorium that has been going on since, pretty early on in the pandemic. But how can you ask people to be healthy if they don't have homes, if they're evicted from their homes, if they have, nothing over their head, if they're struggling to, find a homeless shelter in the middle of a pandemic, when very early on shelters were scrambling to try and figure out how do we keep people safe in close quarters. There are so many different facets, I think, for advocacy in a variety of realms, not just advocating for public, for the public, for individuals, but also for organizations who help support. So again, coming from the community-based organization perspective, recognizing that there are a lot of grassroots organizations like the one you work with, Maggie, or mine, who provide services like enrolling people in healthcare, helping them apply for SNAP benefits, helping them complete their taxes for free. Funding these programs is so critical, and providing that social safety net for individuals, especially during a pandemic, is, again, I know it's a little bit trite, but it helps lift all ships so that we're all operating from a place where, health disparities are perhaps a little bit shorter. And so we, ultimately, hopefully wouldn't see the great disparities in terms of how people were impacted by COVID as we did over the course of the past year.
I love that. It lifts all ships. I think that's a great way of looking at advocacy and public health and with the social determinants of health. So thank you. Dr. Eisenstein, you took yourself off mute. So
yeah, and I tell a story that it just taking it down a totally different path. And I love that story too. Sometimes, look, in my job, I deal with a lot of elected officials, and very often you see the other side away from the public. And one of the stories I tell is in about 7 or 8 years ago, I was a president of the New York State Association of County Health Officials, and I was asked to give the first formal testimony to the New York State Legislature regarding the dangers of electronic cigarettes. I reviewed that speech a couple of years ago, and the word vape was not even in the presentation once. I did say this works by using vaporized gases, but the term vape product didn't even exist. And the story goes as follows. I did my research. It was brand new. We knew it wasn't good for you, but there wasn't a lot of formal data, or there wasn't double-blinded studies on what the potential dangers and long-term impacts were. So I gave my presentation based on the information that I have. And while I was presenting, and of course it's intimidating the first time you're presenting to the New York State Senate, in the big chamber up in Albany, I hear there's like just weird things going on behind me in the audience, and almost like there was a fight going on in the crowd behind me. And as I'm speaking, I turn around and there are people yelling at me, calling me a liar, I'm making it up. And one of the senators said to me, yeah, don't worry about it. It's part of life in the public sector. So I finished my presentation as, a commissioner of health and the president of the Association of Health Officials. And in that chamber, you speak at the bottom and the audience is up behind you. So my speech is done and I was going to go home from Albany. I walked up the stairs. As I'm walking up the stairs, people got up out of their seats and started following me and cursing at me and using foul language. And when I got to the top, there were 2 state troopers there who started walking alongside me. And I didn't know this was going to, I said, you guys here for me? And they said, we're just going to walk you to your car. And I said, am I in danger? And they said, probably not, but you're dealing with big tobacco. We want to just make sure you get in your car and you get home safely. I've driven up and back from Albany 1,000 times. I'm a very key, I could tell you about year after year of advocating for public health funding and all the different issues we fought over the years. But that's the only time I drove down the New York State Thruway, literally watching over my shoulder every 20 seconds because I was being accused of lying, of misrepresenting. And those presentations that you give to the legislators, that's how laws and policies are made. We still, though, have to have the courage and the conviction to stand in there and do that presentation because the other side, the tobacco lobby, is certainly going to have their say. And they're certainly going to take the numbers and make it look like, I mean, at the time they were there, you could say, what could they possibly say is good about this? They were selling this as the way to get off smoking. You know, a smart person says big tobacco is spending money trying to get people off tobacco. Somebody do the math here and figure out what the ulterior motive is or whatever, but this is a true story. And I never, from that, you got to learn. Sometimes in advocacy and lobbying and policy making, there are very strong opinions on many sides. And that was one of the best things that happened in my career because it kind of gave me perspective that, A, your personal safety is the most important thing, but B, what you think is common sense, and this is a big problem in public health. To me, getting vaccinated to protect you from a virus that can kill you and all of your family members, and oh, by the way, if everybody's vaccinated, we can go back to living normal again. Like, that's totally common sense to me. I can't even comprehend that 30% or 20% of our population's adamantly gonna try and refuse vaccination. But that presentation that they really taught me, you've got to be prepared and understand that what's common sense to you is not common sense to everybody else. Money and power and politics carry a lot of weight, and part of being in public health, you're going to be fighting upstream in that. Think about it. One of public health's great successes is cutting down the smoking rate. You're cutting down the rate of something that basically financially funds the entire southeastern United States. I mean, I'm over dramatizing a little bit, but I think I'm making the point here that very often the challenges that we're up against with our very little weapons and our little data and our little flyers and our little studies, you're up against multi-billion-dollar interests. You're up against people with very passionate beliefs, whether they're based on religion or tradition or culture or just what they think is common sense. Trying to keep the public healthy is harder than it sounds. And that's why everybody's got to continually be willing to advocate and lobby. And even though I was the president of the state association way back then, I think it's about 8 years ago, I've stayed on the board of directors and done the lobbying in Albany every single year. And it gets very frustrating to go into the same people and give the same similar spiel about why money should be invested in public health. This year it was a little easier and we didn't actually do it in Albany. We did it via Zoom. But even so, even in the middle of a pandemic, the state budget came out today. There are some cuts to public health. Think about that. And by the way, it would have been much bigger cuts if we didn't intervene over the last 2 weeks in Albany. So we need everybody to stand in there and fight. It's not good enough that one person who happens to be the president of the State Association of Health Officials gets to do the speech. What the legislators need to hear is that person followed up by each of us standing in and saying, no, this is my view from a social determinants perspective, the way Marissa describes. This is my perspective from an emergency room physician's perspective, the way Dr. Moskovitz would. And everybody's got their way that they can contribute to this. We're all responsible. Every one of us, whatever your role is, whatever your title is, wherever you work, certainly colleges and universities have that role as well in fighting for social justice and what's right. But public health needs to do, doctors traditionally do a terrible job of advocating for themselves. If doctors had the lobby groups that law firms, that lawyers did, it would be a very different profession. We're great at medicine, we're great at caring for people, we're not good at advocating for ourselves. Public health needs to advocate for itself. And if this isn't the time that we unite and make public health stronger for the future, it's never going to happen. This is our opportunity. I hate to say it. Anytime somebody in my department, and we've worked 7 days a week for a year, around the clock, day, night, we're starting to get tired. Everybody's tired. And when I hear people complain, I remind them, hey, this is your shining moment. If public health can't stand up now in the middle of the worst pandemic that we're going to have in our lifetime, you might as well not have a health department. So this is no time for excuses. This is our time to shine. And that extends into everything that all of us that are on this screen and even the students in the room are doing as public health professionals. I'm done.
I'm going to hop in there and say, advocacy is probably the least fun for a lot of people because it's hard, it's awkward, and it's not exciting, right? So you get these bills that are long and wordy and not in English. They're difficult to read, and going there is awkward, but it's so vital importance. I actually go to Albany quite a bit as well, pre-COVID. I used to go to DC quite a bit as well with my college for emergency physicians. And showing up year after year is so important to establish these relationships and getting to know somebody. B, learning to speak to your audience in a way they can understand is so important. We, unfortunately, are very fixated on speaking about statistics and outcomes measures and probability. They don't want to hear any of that stuff. Sometimes they just want to hear a story about one kid who died. And that's how sepsis happened in New York State. One child died of sepsis, and now we're all forced to change our practice in emergency departments across the whole state. It's called bundled plans of care. It's fluids and lactates and cultures and labs and da. So people who come in with a flu-like illness who need emotion and a discharge are getting sepsis bundles now because one child died. I'm not saying it's a bad thing that that ruling was passed, but I'm just saying these are what happens if we're not at the table to fight and argue for these things. And so, I go to the New York College of Emergency Physicians every year to Albany to fight against some of these repeals. And some come from good places sometimes, these complaints. They come from good areas. They just don't know, and they didn't know who to ask, and they asked someone else when they should have asked us. And we weren't there because we were out doing something else. So we didn't think it was important to be there. I remember, opiates. Opiates are a huge problem right now, right? And I remember a few years ago, I was fighting to stop increasing certain action plans with opiates. Not because I don't want them to do things, they're doing them wrong. For example, they wanted to pass a bill at one point that said physicians are mandated in the emergency department to call the person's primary care physician if they show up for an opiate overdose. We're mandated to report it to the state, and we're mandated to give them some other stuff on top of it. And I was like, all right, well, what happens when the guy bought the drugs illegally off some drug dealer on the street? Who do I call? And if I got a label in the system, what happens? So let's say you show up, and one of the things was Narcan. Was if someone gets Narcan in the ER, I have to label in the system they got Narcan. Now, the unintended consequence is, someone shows up in my emergency department tomorrow because they passed down the street and they got Narcan because they know what was wrong with them. Turned out they were just low on their blood sugar or were exhausted or dehydrated, but guess what? They got Narcan. And now their name is labeled in the computer system somewhere in the state as receiving an antidote for an opiate overdose. And it's very easy how that path can get blurred. And also you're labeled a drug user when you're not. And so this is where laws can kind of get very dangerous and out of control. We're not at the table advocating. Now I go, every year I have relationships. I get emails sometimes, I call them sometimes. I know a couple people running for the city politics now, and I hope those build in something meaningful so that one day when there's a really important question, they call me instead of some lobbyist who's paid a lot of money to influence what their organization wants. Yeah, no, smoking's not that bad. Vaping's not that bad. It's cool. It's just a little, it's humidified air. That's all it is. No, this is our chance to interject, and you gotta learn your audience. You gotta change your story, your narrative to what they want to hear. I liken a lot to breaking bad news to someone. You don't just walk in there and say, hey, this person's dead. You got to figure out the person knows what they understand, what their knowledge level is. And you'd be surprised sometimes when you speak to some of these representatives, their knowledge is sometimes really amazing, sometimes not so much.
Yeah, absolutely. I think you guys have all brought up some great points. And it's, if not now, when? And then to quote Hamilton, you got to be in the room where it happens for all of this, some public health advocacy. And Carrie, I see that you took yourself off of mute, so go right ahead.
Yeah, just definitely agreeing with what Dr. Eisenstein and Dr. Moskovitz said. I feel like kind of the point is like public health isn't easy, and the term fight is very accurate. And I think a term that we used a lot, like our cohort kind of like held on to for some reason, was fighting the good fight. And because it's not easy and it's hard, and advocating for that policy is hard. And there are people that don't want to hear what you have to say and don't want to hear what like the data says and what the facts are. But we're the ones in the position to fight for that. And it just reminded me, you know, what Dr. Moskovitz was talking about with the opioid epidemic. I actually did my CE on that in the program. And one thing that was brought up was safe injection sites. And it's basically just having a safe place for, you know, heroin users to do heroin. And it's like initially, you know, people, or initially anyone would think that like, why would you want to give, you know, these drug addicts, these like horrible people, like a place to continue doing what they're doing? It's like, well, we're actually trying to like kind of save lives. And it actually turned out that that was like a good thing to have. And it was a chance to maybe intervene and get these people, or get them to, you know, look into treatment, or, you know, XYZ. So it's just like fighting for the things that actually do help and actually do matter, even if it's not what the public or what, you know, the lobbyists want to hear. Yeah. So that's my spiel.
Yeah, on that topic, one of the most amazing public health interventions, in my opinion, was, I hate to say this, was needle exchange trucks. This was hugely unpopular back in the 90s, 2000s. I forget exactly when. It started off in San Francisco. San Francisco had a horrible HIV problem from sharing needles. And they put these trucks out there and said, bring us your needles. We're not going to, you know, ask you questions. Just give you fresh ones. You bring us a dirty one. That's it. And it tremendously plummeted the rates of HIV and Hep C. They instituted in Baltimore when I was down there as a resident. And I was a big advocate for it because, you know, it really made a huge difference. The safe havens for injecting is very controversial because people don't want them in their backyards. It's a NIMBY policy. I don't want that in my neighborhood. I don't want to attract that crime, that warranting. The trucks were a little more palatable because they were mobile. They would go to local sites where people know they tend to have higher rates of use and then leave. But, you know, trying to craft that message to make it palatable for people and also knowing the personal experience. You find one politician who had a death in his family from an opiate overdose. That's a very different story now. You're going to find a very powerful advocate in your corner. You know, a lot of these opiate bills that get put out year after year is because they've had family issues and they're very passionate about it. Unfortunately, their passion's a little bit misdirected and they really need to tighten up some of the reins on it. I just, you know, finding that way to close that gap has been challenging. But find someone who's got a common interest in you, find an interest, try to channel that interest and develop a relationship. If you don't do the relationship, they're never going to go anywhere.
Absolutely. Thank you guys so much. I think you brought up a lot of really good points, and public health is first and foremost a team sport, and we all have to kind of come together to sort of, just like Marissa said, lift all the ships through improving the social determinants of health, through policy and advocacy, through lots of work. So many of our attendees are current students, both undergrad and graduate, or maybe some are recent grads. And I want to make sure that I allow some time for questions. So participants, don't forget, you can add some questions to the chat. But I want to hear from each of our panelists on just if you could give one piece of advice to a new or just starting out public health professional or someone who's interested in going into the field of public health, what would that be? And we'll just go in order for same as we started. So Dr. Moskovitz, take us away.
You know, you have to learn to ask for help along the way. And just don't be afraid to just call a random person that you have some big connection with to say, hey, what's up? Can you help me with this? Some of my best mentors in my life came from those kind of interactions. My first one started, I was in college, my final year, I was hosting a conference and this emergency physician showed up to see what this EMS conference was for college students. And when I got into med school, I called him up and said, hey, I met you once for 5 minutes at this thing. Can I come say hi? And that's how a relationship developed. And little I know, he was actually a bigwig in the field and really helped foster that. And that has happened to me at various levels of my career, is just calling someone, asking for help. You took someone's class once, you wrote a paper by them, you ran into them at some event, just call up and say, hey, I have a common interest. Could I pick your brains? And you never know how a relationship goes. And that's really what helps Bud. And that's where jobs come out. Just as Dr. Eisenstein said, how his first job developed from that. And it kind of grew from there. It's just really fascinating how if we just more said hello and we're a little nicer to people, we'd really have some amazing opportunities.
Awesome. Thanks so much. Dr. Eisenstein.
Yeah, along those lines, and I think this really kind of is along the exact same level of conversation is, be prepared for your opportunities. You're all going to get opportunities. There are a lot of times where I've done events like this, and we used to do a C-suite event where we'd all be sitting around the table in Hofstra, and students would have a chance. And there are students who want to work at a health department, and they've got the commissioner of health. And forget that it's me. It doesn't matter who it is. That's not the point. The point is, Hofstra's put you at a table with the commissioner of health. That's your time to shine. That's your time to create the relationship that Dr. Moskovich just talked about. Now, you're not going to be my best friend or any commissioner's best friend in 5 minutes, but then the door is open to you. That meeting, you now can follow that up and say, I want to do an internship next summer. It's now April, which is when we hire our interns, and we have paid jobs too. Let me send a letter to the commissioner. Let me send a letter to whoever it is that I really enjoyed it, and maybe this is my chance. Hofstra created this opportunity. That C-suite event put CEOs of hospitals and nursing homes and all kinds of great social service organizations and facilities, whatever your interest is. If you're getting an MPH, this program gives you the opportunity to mingle with the leaders in the field. Take that opportunity. Going back to my story, when that call came in from a commissioner of health who I didn't know, I had met her once, and she asked for a favor, always say yes to that opportunity. A lot of students come to my health department with a preconceived notion of what they want. They only want an internship if it can be restaurant inspection, or if they can do WIC program with pregnant women. I'm only interested in maternal health. Be open-minded to other opportunities. Whatever opportunity comes to you, that's where it begins. When I graduated from fellowship as an infectious disease doctor, and as I told you, I got a grant, and my first job was doing STD work. That wasn't my first choice. It wasn't, to be honest, but that's what was available to me. And I took the grant that I got to fund that in my HIV program and turned it into being the commissioner of health, and that doesn't happen to everybody. There's one commissioner of health, but everybody has the opportunity to advance yourself and to find these places, these chances that are just waiting for you to pounce on them and go ahead. And one quick story, I have a student who's an MPH who I gave a guest lecture at a different university, but on Long Island, doesn't matter which one it is. And I gave a guest lecture, and a couple of weeks later, we had an emergency drill. And I happened to mention during that class, it was like a 2-hour, what does the health department do, entry-level class out in Suffolk County. And I happened to mention, I was talking about emergency preparedness, and that we were going to do a disaster drill. And we were looking for volunteers and people to come play dead. And this is how we practice for when the real pandemic happens or the real emergency happens. And so this student was graduating or wanted a career, whatever I forget what the details were. But so now it's 2 weeks later, I'm at this disaster, and I'm walking around. There are people covered in ketchup, as if they're bloody and dead. And so it's a drill. And as I walk past her as one of the team leaders, she opens her eye and looks up at me and says, "Dr. Eisenstein, can I speak with you?" And I said, "No, you're dead." And then I said, "But talk to me after." And when it was over, she came over and she said, "I was a student at that lecture a couple of weeks ago, and I'm going to be graduating with my MPH, and I really want to be an inspector, and I didn't know how else to meet with you, so I volunteered for this disaster drill that you mentioned in the class, and I was just hoping to get to meet you and hand you my CV." And she gave me a ketchup covered, because the ketchup was the fake blood, a ketchup covered plastic CV, and I hired her that day. I called her program director, who I know well, just the way I would Dr. Kiriakou, who is also a good friend and I know well. And I hired her that day. Be creative in seizing your moment. It's great. It's great that Hofstra sets you up. It's great that there's so many people that you can ask for help. And I fully agree with Dr. Moskovitz, ask for help. You have the Northwell system here. You have Hofstra here. You have the NYU system and the Catholic health system. You have so many The Health and Welfare Council. You have so many different groups, depending on what your interest is. It's up to you as students to seize the opportunity, and public health needs you. So be a little bit flexible, pounce when your moment arrives, and really everybody, it's up to everybody to find their moment. And it doesn't happen every day. You have to work at it, but it will happen. I think.
Follow up
Awesome.
though. Follow up afterwards. Thank you. I didn't hear back from you. Don't just for one time and run away. You gotta follow up, please.
And
Yes.
if you do get an interview, please don't show up in a torn Led Zeppelin t-shirt as happened last year.
They don't know who Led Zeppelin's anymore. Come on.
That is a true story.
I feel like you told that story, I think, once on one of these before. Yeah. Yeah. So persistence is key. Awesome. Thanks. Next up, we have Arpita, your little nugget of advice.
Okay, so I do second what Dr. Einstein mentioned. From my own experience, I've seen one has to be open to opportunities wherever they come from. It doesn't mean you might want to take it, but you should definitely go for the interviews, explore. When I was looking for a job, not every job is going to come and say, have a public health keyword in the description, but it might be a good fit for you, like it was for me. I'm presently working as a risk management analyst. To be very honest, I did not know what risk management is. And a recruiter approached me and said, you have a background and you might be a good fit for this. And I talked to her and I'm like, okay, let's give it a shot. I went for my interview and then I understood how my whole background aligns with it, and it aligned perfectly. That's why I got the job. But in my department, I've seen, though I would say it's a risk management department, but I see a lot of public health graduates and I see that everybody has those skills. Hofstra having a generalist program, it equips us with a lot of skills, which even if they're not, directly the skills that you think you would be using, they're still applicable in other fields, other ways. For example, the quality, Dr. Hackett's class, I learned about a program plan, and I work with the improving health outcomes. So I went ahead and used the program plan from Dr. Hackett's class to quality improvement program with improving health outcomes. So it's just about being creative. We all have the skills that we learned at the program, and we all have that passion for improving the health of the community wherever we can. So just be open to opportunities when they come. Be open to exploring. Don't get stuck with this is what I want to do, and you never know what you might find. And hopefully, like me, you'll also find a fulfilling career. And that's it.
Hi, sorry, I just didn't mean to interrupt, but I do agree with what Dr. Eisenstein, Dr. Moskowitz, and Arpita said, because I myself on the visa status, so I knew the difficulty of getting the job as soon as I graduated. And I remember how I was meeting Dr. K, Dr. Kirakau, Dr. Hackett, and Dr. Santella like almost every single week to get the connections and grow the professional network. And after 6 months, health analyst. And to be honest, how Arpita said, I never knew what population health was, like how value-based care programs were working, and how I was going to use my analytic skills with those value-based care programs. But like I just gave it a try, and I think currently in my company, I'm a go-to person for any department, for any reports or any analysis related thing. So I definitely agree with everyone.
Thanks, Utsavi. Next, Marissa.
Sure. So, I agree with what everyone said. I think a key thing for me has been flexibility over the course of my career, understanding that if Superstorm Sandy never happened, I wouldn't have created a charity racing team, which wouldn't have gotten me to the Health and Welfare Council, which wouldn't have ultimately gotten me into sort of this public health work that I'm doing, when initially I thought I was going into education. Never in a million years did I think I would have been working to develop a technology across Long Island that allows for community organizations to make referrals between one another, which is a really exciting project that we're working on right now, which is meant to connect, paid or clients to community-based organizations and the variety of services that they offer there. One thing that I think I feel strongly about is always feel, or try and identify whatever it is your commitment is to. It doesn't necessarily have to be to a very specific goal or to a person or to a company or to a job or to a location, and recognize that whatever motivates you, be flexible with that as well. For me, it was what I thought it was inner city education. That was my goal, but in reality, it was, again, in a very broad sense, improving the human condition, which I think is probably what motivated most of you to go into some realm of public health. I think if the core comes from that, a lot of things won't distract you and won't deter you and won't maybe discourage you in times when the work feels overwhelming or daunting, or you don't like your boss, or you had a bad day at work. So I think that would be, sort of, the one thing that I would mention, and also just a plug again for community-based organizations and recognizing that public health really takes a really, really wide, and I think that's been, very much expressed over the course of this conversation. But, I mentioned previously that we run a disaster response coalition, and in coordinating the nonprofit community, never in a million years would I think that 3 of our most active subcommittees, behavioral health, legal, and nutrition, would be the ones that we would, be most active in response to a pandemic. And so I think that's really telling about just, again, how varied human needs are in terms of well-being.
Awesome, thanks. Carrie.
Yeah, and I definitely agree with what everyone said as well, especially in the theme of opening yourself up to different opportunities. And I guess I would just add, not only open yourself up to different opportunities and things that come your way, but also purposefully explore different spheres of public health, because as we've said again throughout this talk, there's so many different things that you can do with public health. And this program gives you the chance to explore them. Like for me, when I was in the program, I knew that like my main interests were kind of preventative health, and specifically like nutrition and fitness and obesity prevention. But then I did, like I said, I did my CE on the opioid epidemic, which was just like completely out of left field for like what I was interested in the program. And I actually just kind of learned that I actually like really liked the process of, creating a policy brief, which was what I did for my CE. And that was like something that I didn't really think about before. And then just when I got my first job, it was at the Cancer Institute at Northwell in research. And I was like, oh, I don't want to work in like cancer. Like, I really don't want to do that. And then my mom actually was like, well, it's better than no job, so you better take it. And Northwell is a great place to be, and blah, blah, blah. So like, and that's another thing I feel like people always say, like, oh, get your foot in the door here, get your foot in the door there. And it's like, that's definitely true, because everyone has definitely gotten a job from somebody that they know and then gotten the foot in their door somewhere. And so let me think. Yeah, I think that's kind of, I don't know if I have anything else to add to that, but kind of what everyone said, plus, just not to sugarcoat it, get your foot in the door and explore what you're interested in. And you might find that you're interested in other stuff too.
Yeah, absolutely. Explore your interests, try something new, say yes, show up, all of that. Awesome. And last, but certainly not least, Aditya.
Thank you. So, for the new public health professionals, I think it's really important to understand how diverse public health is. That it spans across so many different sectors, and I think as Arpita mentioned, job title may not have the word public health in it, but that does not mean public health isn't there, or that you can utilize your diverse skill set in that position. As everyone mentioned, the importance of making connections and networking with individuals, because that really makes such a big difference of someone who remembers you. And it's not just trying to keep a long-term relationship, but putting yourself out there. You may not be comfortable with networking, but just putting yourself out there, having a conversation, it can lead to many opening of many doors down the line. And for myself, I interned at Northwell as an administrative fellow, and by keeping in contact with my managers there, that's how I ended up getting a position as a research coordinator. And because of that, I then became a supervisor. And now I sit at a clinical trials leadership committee for the entire organization. So it's just by just little steps of just putting yourself out there, taking initiative, and really putting on your own ideas out there. And I think it really does speak for itself.
Absolutely. Thank you so much to our panelists for their wisdom. And I did see in the chat that we do have a question. So this is from Shelley. I'm going to pose it to the panelists in our last 10 minutes. We can quickly answer that and then or quickly try to answer it, and then we can wrap up. So Shelley says that during the pandemic, I found that many people were not aware of their own protection. Everyone knows that wearing a mask can reduce the risk of transmission, but they still don't wear the mask properly, expose their noses. What can we do to improve public health awareness and education, just broadly?
I'll mention really quickly, you know, and this is sort of a generic note, you know, one of the things that we say is that messaging takes multiple touches. So we say sometimes people don't really understand something or don't really hear it until the seventh time that they've heard it, which sounds pretty repetitive. You know, the covering your nose thing, I think we've heard many more times than 7 times over the course of the pandemic. However, I think one of the things that we found really beneficial in a lot of the work that we've done is recognizing that there are multiple pathways. You know, very often I think we take a top-down approach that we put out something from the CDC and we just assume that everyone's going to believe it and agree with it and listen to it, when in reality sometimes it's trusted community leaders, they're faith-based organizations, or you know, the people that they trust who they work with or interact with on a daily basis. Those are the people that they sometimes get their information from. And so you know, and not to discredit doctors, you know, I think people but there are certain populations who have some distrust. I mean, look at how people are responding to the vaccine despite the ridiculous amount of information we have. And as Dr. Eisenstein mentioned, like nobody who has had, you know, 2 doses of the vaccine has died, and yet people are still coming up with a million reasons to say, this is why I'm not going to do it. So, you know, I think one of the things again is very often, you know, complex information can be disseminated through a variety of channels through our community partners. And I think that's, you know, one of the great things that I love about the Health and Welfare Council and the work that we do is really engaging everybody in that conversation and not having it just be sort of one-way communication, but rather more of a conversation.
And, you know, this goes back to something I said earlier, which is what's common sense to you. And by calling it common sense, you just assume everybody else agrees with it because it's common, but it's not. And so this question is not correct. The question says, quote, everyone knows that wearing a mask can reduce the risk of transmission, but exposes their nose. Let's start with just the first part of it. I hate the part when you see somebody wearing it just over their mouth. It's almost like mockery. But here's the bottom line. Everyone does not know that wearing a mask can reduce the risk of transmission. That is what we would consider common sense. You've heard it 9 million times from every single scientific mind. But the reason people don't do it, which is really what the question is, why are people having a mask hanging off their chin or off their ear or whatever other body part you want to say? The bottom line is there are people that don't believe it. There are people that think that this is a master plot from the mask making company to make billions of dollars. There are people that think the vaccine is from big pharma, a plot to make billions of dollars at the expense of people. There are others who feel that the mask itself presents a greater health risk than not wearing the mask. There are others who feel that if they did catch COVID, they don't care. They're just not willing to deal with all of these restrictions. So it's not true that everyone knows that wearing a mask can reduce the risk of transmission. That falls into the category of common sense that's not common to everybody. And the reason that people don't do it is multifactorial. Some of it is just blatant ignorance, and people just are not going to listen to authority. There are people that no matter what it is, they don't want to hear from authorities. They don't like that there's a Dr. Fauci or a police chief or a teacher in a classroom or whatever that authority is. There are people that's a whole psychological discussion separate in its own. So it is multifactorial why so many people resist wearing masks. You know, this goes back to, I think in public health, the thing that's most frustrating to me is the anti-vaccine movement. And that's not related to COVID. It now is related to COVID, but this I would have said to you 2 years ago before COVID started. It just is common sense. All the math works. All the math works that vaccines work, that have saved millions and millions of lives. It's really not debatable, yet people debate it. And so what's common information and common knowledge to us in the public health world, there's a segment of the population that doesn't agree. And so risk in public health is viewed differently than it is anywhere else. And this drives me insane. So what do I mean by that? Well, everybody knows that every time you get in a car to go somewhere, drive to work, there's a very small chance you're going to get into a car crash and die. There's very low risk, but there is risk every time you get in a car. And yet we still get in our cars every day. And we love Long Island. We love our beaches. We walk along the beach. There's a risk anytime you put that foot into the water that a shark is going to bite you and you're going to die. It's a very small risk, or that you're going to step on a shell and cut your foot and get sepsis, like Dr. Moskovitz talked about before. Very low risk, but there's a chance. Yet we all do it. Some people take higher risks. They go to a bar and have a few drinks and drive, knowing that they probably shouldn't. There's so many things that we do that's risky. You know, I used to run an STD clinic. I could write a book on the risks people are willing to take in that realm, you know? But when it comes to a vaccine, where statistically the death risk is really no different than any of these other examples that I've given you, virtually these vaccines are incredibly safe. There's a whole different value. This goes back to Dr. Moskovitz talking about value system. People don't value the risk when it comes to an injection, a vaccine, the same as they do everything else basically that we take risk in life. People choke on grapes and die from eating grapes in this country every single day. I still eat grapes every night, you know? A lot of the people who who are anti-vaxxers eat grapes and walk in the ocean and drive their car and participate in other very low risk activities, but there's some risk. Yet when it comes to vaccines, the whole value system changes. So when this question is, everyone knows that wearing a mask can reduce the risk, but expose those, what should we do to improve public health awareness and education? It sounds like such a simple question. It is so hard. It is so hard. It's all encompassing. I used to get into violent screaming matches with vaccination people, and I would say, where do you get your information from? Oh, I know it. I'm an infectious disease doctor. My life's work was studying virology. This is what my life's work is. I spent years and years. I don't claim to be good at anything else. Anything. Maybe I can be funny once in a while, but I'm certainly not an expert at anything else. My kids will tell you I'm not an expert at anything else. But when it comes to infectious diseases, that's my life's work. Yet people that find out their information from a movie star with no medical training, or their neighbor who goes out and sweeps the lawn and sweeps the front walk and pontificates medical information, that's who they believe. So it's more than education and awareness. I think it's about trust. And this is why it's so important that public health, whether it's governmental or community agencies like the Health and Welfare Council, whoever we are, that we make ourselves a partner with the community, that we establish a trust with the community. You can give all the education in the world. If people don't believe you, you're not preaching anything of value. To me, it's about establishing a trust so that people that would not come to the health department for guidance become just a little bit more open-minded to that. So to me, that's why I never pass up an opportunity to meet with any community, to answer any question that might seem like common sense to me, to hear it out, to understand where this misinformation is coming from, and to try and, even if I don't correct the information and people don't believe me, try and get them to at least hear what I'm saying. That's really the battle. And it's very different now than 10 years ago when I was a new commissioner, where I was just going to come in blazing with I'm the expert in infectious disease. You should listen to me because this is my life's work. That doesn't work. It really doesn't work. You know, Dr. Fauci I have my issues with some of what he does and says. I always have, but he's the one that wrote the textbooks that I studied. You have the world's leading public health infectious disease person speaking, and half the country mocks him on a daily basis. So that alone isn't going to work. It's about establishing a trust. Education, you can give all the education you want. If people aren't going to hear you or trust you, it doesn't matter what you say. So to me, the primary thing public health needs to do is establish a trusting relationship with the members of our community.
Absolutely. Thank you so much, Dr. Eisenstein and Marissa, for your insight on that question. The course that I teach is health promotion and disease prevention at Hofstra. And we talk about health education and the communities that, we serve as health professionals. And a lot of it is just meeting people where they're at and figuring out what they need to know to make a healthy decision. And you gotta, just like Dr. Eisenstein said, you have to build that relationship, build that trust, be a part of the community, and really get them to listen to what the information that you have to say, because there's always somebody who's going to be saying, someone without expertise, without your knowledge base, that's going to be saying it louder, that they're probably going to hear. And so that's a lot of what we do in public health. So I just want to be mindful of everybody's time. It is 8 o'clock. If you guys who are in attendance have any questions, you can email Tony, who will pass them on to me, and I'll make sure that they disperse to our panelists. Thank you so much for taking time out of this really busy, hectic week to come talk to some of our undergraduate and graduate public health students. I really appreciate it. Thank you for always answering my emails too. So that is really great. And yeah, so thank you guys so much again. Have a wonderful rest of your evening, a wonderful rest of National Public Health Week. Yeah, and if you need anything, you can email Tony and he'll get a hold of me. So thanks, guys.